inside your medicine cabinet? And more importantly, does your body really need it? Doctors say Americans rely way too much on medications without really understanding the consequences of introducing your body to foreign chemicals. Fox 13's health reporter Lauren Johnson joins us live in the studio with this story. Lauren?
Hey there, Merle. Here in Tennessee, the problem seems to be worse than it is in other parts of the nation. In fact, people living in the volunteer state take 42% more prescription meds than the average U.S. resident. Doctors say the blame doesn't lie solely on the patients.
The first layer helps you fall asleep quickly.
When you're depressed, where do you want to go?
You need simple blood tests to check for liver problems.
We live in a world driven by advertising.
You got me thinking about my health. I knew I had to get my cholesterol under control.
With all the advertising, patients are coming in saying, I want this medicine and this medicine only.
Everywhere we turn, the temptation to try something new.
That drug companies are putting ads on television, on magazines, and in the newspapers, pushing the new and different medicines.
No one. Depression hurts in so many ways.
Well, when it comes to our health, doctors say being bombarded by promises of a pain and symptom-free life can be dangerous.
We see patients who want a medicine, a pill, for every ache, every pain, every problem.
With patients begging for relief, doctors must decide what happens next.
Often, if it's appropriate, we talk about it. But sometimes when it's not appropriate, it's hard to convince them out of the drug.
The problem is, not many doctors stick around to have the tough and sometimes awkward conversation. Dr. Ann Payne Johnson says it's a different school of thought in what she calls old school medicine versus modern medicine.
The older doctors, but the older practice methods are that a patient hurts, you give them pain medicine.
Payne Johnson says newer physicians like herself focus on the health of the patient over time instead of instant relief that comes with popping pills.
We start with the patients. We start educating patients on what medications really are for and what happens to them when they stay on them for a long time. They can cause liver problems, kidney problems, addiction.
Carmen Nkia, a pharmacist with Baptist Memorial Healthcare, says people often forget about the side effects of medications and the consequences of mixing two or more medications.
Even though their medications are either prescription or over the counter, someone approved them, you're still giving yourself something that is not normally part of your body.
And Kia says her hands aren't the only things working when she fills prescriptions. She has to keep her eyes open for people attempting to abuse the system.
We look at their profile and see how often are they coming in.
In Tennessee, hydrocodone, a painkiller, is the #1 drug prescribed by volume, and many times it's abused and sold on the streets for recreational use.
When patients abuse medications, a lot of things can happen. You can either become psychologically or mentally addicted to the medication or physically addicted to the medication.
Hydrocodone will be prescribed for back pain, and it's hard to determine if someone is really having back pain or not.
It's also tough to tell if patients are following the doctor's orders once they are granted the goods. That need to feel better leads some people into taking a prescription cocktail.
A patient has, say, a heart disease, diabetes, emphysema, and they see 4 or 5 doctors. Each doctor gives them 2 or 3 medicines. By the end of it, they begin to have 15, 20 medicines.
Dr. Manoj Jain says the volunteer state has the highest drug-drug interaction rate among patients and the 6th highest inappropriate meds among the elderly.
Doctors in Tennessee, on average, gave out 17 prescriptions per patient in 2006, while the national average was just 12 prescriptions.
And Jane says Tennesseans spend an average of $1,300 a year on meds, $300 more than the average American. Both doctors don't exempt themselves from being part of the problem, but they hope to also be part of the solution.
If a patient has back pain, well, you can't just keep giving them pain medicine. Get to the bottom of it and get them fixed.
Using physical therapy, encouraging more active lifestyles, helping Americans lose weight, and quitting smoking, all therapies that can help cut back on depression, anxiety, high blood pressure, pain, and the rest of the conditions we pop pills for, many times unnecessarily. All right, we want to know what you think. Do you think we as Americans rely too much on medications? Sound off on our website in the comments section at myfoxmemphis.com. Live in the studio, Lauren Johnson, Fox 13.